professionals here,
Right.
not like a crowd of people, the general public.
Yeah, that's usually who I teach.
Just to remind.
Back it up for a second. I just want to. Okay, so now we're going to talk a little bit about gender nonconforming and transgender youth, and a little bit about their families, because they're an important piece of that puzzle. An important thing in working with trans youth and their families is understanding the impact of societal expectations, particularly on parents. Kids get it from the very beginning, but parents really hold the bulk of it. So parents of gender nonconforming kids, they're often held responsible for what their kids do, and society has a tendency to blame them if their kids are not gender appropriate. Some parents, because they feel the pressure to do this, to raise their kids a certain way, will resort to abuse, emotional, physical, and sexual abuse. That's certainly not all parents, and the recent studies are showing that the parents who are very supportive of their kids have much better outcomes. But there are certainly people who have struggled with this stuff because gender is such a powerful force, and our ideas about gender roles are that they may resort to certain things to try and get their kids to behave properly. They also may be very disgusted by their child's gender presentation. We find this a lot with dads with their boys who present feminine, that they struggle with that and what they expected for their kid. They may kick older children out of their homes. They also, there are a lot of parents who affirm their kids' gender, and those who do may be criticized, ostracized, and blamed. It's not uncommon for CPS to be called on a parent because they're allowing their child to socially transition. So for kids who don't fit the binary, they may try to hide their true gender identity, and in doing so, the outcomes for them is pretty poor. That leads to depression, anxiety. There's research that shows that 50% will attempt suicide, higher rates of substance abuse, self-mutilation, and risky sexual behavior. You see this a lot in the LGBT, the lesbian gay community as well, when they're not supported or they're being bullied or harassed in school. Children who cannot hide their experience of gender get harassment at the hands of peers, teachers, parents, and they have a higher level of homelessness, and also they can engage in prostitution as a survival mechanism, especially if they get kicked out of the house. Children who have expressed transgender identity and nonconformity in grades K through 12, there's a study, the National Gay and Lesbian Task Force that just came out, it was done in 2011, found that these kids 78% of them reported alarming rates of harassment. 35% were physically assaulted at school. 12% experienced sexual violence. Harassment was so severe in schools that 1/6, 15% had to leave school. And I can tell you a lot of the parents I work with remove their kids from schools that are transgender because they're being harassed and they can't protect them any other way, so they end up homeschooling them. Children who have been harassed and abused by teachers in K through 12 settings show dramatically worse health and other outcomes than those who did not experience those abuse. So the teacher, that is even more damaging for those kids. So a little bit more about sex and gender, just for kids, and this is a little bit about the intersex community. We have chromosomes, XX and XY, XX being female, XY being male. But it's important to know that there are actually about 13 genetic variations of sex that we don't actually acknowledge. And many of those people present differently than the standard male or female phenotype, which is your body. Some of them identify as opposite than what their bodies look like. Some identify as both. Your secondary sex characteristics are those things that develop when you get breasts or testes and all that. That's all the stuff that happens in adolescence that really defines your sex. Those are your markers of gender. So We already went through the traditional model. Just go forward. You're going
So
backwards.
just keep going.
Yeah, right there. So given the traditional binary gender developmental model, where males are masculine and they're straight, they like women, and girls are feminine and they like boys. The idea traditionally was that children are born either a boy or a girl, so intersex children are not considered a part of this, and actually they're considered a social crisis. They have to be fixed with surgery right away. They have to be one or the other. And the idea is between 18 and 24 months, their core gender identity is thought to be fixed, and so you have to fix them early. There's been a lot of backlash in the intersex community around this because people have lost their sexuality. They've been assigned to a gender that doesn't fit for them. There's a lot of different kinds of things that have happened. Parents were told to train them to be a particular way, so if it was a boy, traditionally that they turned into a girl because their penis was too small, then they were taught to only let them wear pink and dresses and play with girls' toys, and then they would be socialized as a girl. What we know now is that doesn't work at all, and a lot of people are complaining about these early surgeries on kids. There are now doctors that are beginning to challenge those ideas. That's a good movement for them. In the preschool years, children learn how to act, feel, dress, and perform as a boy, girl through socialization. This is part of the normal process, supposedly. This is how you learn your appropriate roles. By age 6, if all goes normally, a child is both heterosexual and gender normative. So that's the traditional model. The new model is one that's a little more accurate to what we actually see in the world, particularly those of us who work with gender nonconforming kids, is that it's fluid. You know, that kids do switch their gender after 24 months and they're doing fine. Gender development does not appear to stop at age 6, but it goes on from birth to death. We move through gender in very different ways. You might even notice with heterosexual couples, as they get older, they start to look alike, that they start dressing in more similar ways, that the women don't look quite as feminine, the men don't look quite as masculine, and that there's ways in which those things shift for people, no matter who they are. Children are telling adults their gender as young as toddlers. This is true. There's a lot of kids, particularly the kids with more body dysphoria, are stating who they are much younger, and parents are beginning to listen to this. What we also know is that gender is focused in the mind and brain and not what's in between the legs. Important stuff in this is the research that's been done on the brain, and also what we know about development of sex, that a lot of it happens prenatally, and that it has to do with different times that hormones are influencing the development of the brain and of the genitals, and that oftentimes the brain, what they're finding is the brain of transgender folks is more similar to that, particularly transsexual folks, more similar to that of the opposite gender. So their brain develops in one way and their body in another, which is where we get the dysphoria. The expression of gender characteristics, and including identities that are not stereotypically associated with one's assigned sex at birth, is common and culturally diverse human phenomenon that should not be judged as inherently pathological or negative. That was a statement made by W. Path. I think that's an important one. So one way to think about gender, rather than think about it on those lines that we were talking about, is to think about it as a web. And it's a web that includes a lot of different things. It involves chromosomes, hormones, hormone receptors, gonads, primary sex characteristics, the secondary sex characteristics, your brain, your mind, socialization such as family, school, community, culture, values, ethics, laws, theories, and practices. All of that stuff goes in to create the gendered being that you are. So a few other things to know, terms that we talk about with kids, and it's true of everybody, is there's this idea of a true gender self, and that's one's authentic internal gender identity, how you really see yourself. And then there's this false gender self. It's the gender presentation that you develop that is meant to protect that true gender self, and it's a way to comply with social norms. So you'll see kids who try really hard to be what their assigned sex is so that they can fit in, that everybody will love them, that they'll be accepted, and at some point that doesn't work anymore. Sometimes it doesn't happen until they're adults, that they actually have to shift things, but at some point, if they're transgender or transsexual, they often come into conflict with this false self and the true self. And I would say that really finding, a lot of the work is helping people to find their authentic, true gender self. Can you back up? I have trouble reading that. So there's also this idea of gender creativity, which is sort of the weaving together of the unique and authentic gender self based on one's identity and their chosen gender expression. So it's that special way that each person develops their gender. And it's like a thumbprint in many ways. Although, unlike a thumbprint, it's variable and can change over time. So there's a lot of ways in which kids present, and I'm not going to go into all of the different ways that they show up, but just to say that kids are really fluid in their gender presentation, and they have different ways. There are some kids that are transgender. They're very often very binary. They know that they're the opposite of their assigned gender. They're very clear about that. There are other kids that are very fluid. They kind of float back and forth, and you never quite know where they're going to land. And they may end up growing up to be what's considered gender normative heterosexual folks, but they have a gender fluid childhood. There are kids who kind of do a mixture of the two. Some kids have called themselves gender Prius, sort of gender one in the front, another in the back, or a Taurus, like the idea of having one gender on the bottom and one on the top. There's ways in which they think about these things that are very different. There are some kids that express a sort of a gender non-conforming behavior that are actually going to grow up to be gay or lesbian. There are some kids that just don't want to declare anything. They might be gender queer or gender smoothies, in which they blend it all together, they mix and match. And there are some kids who are what we call proto-transgender children who may first present as a sexual identity. So you see this a lot in the lesbian community where, or FTM spectrum folks, where they will identify as lesbian first because there's a place for masculine women there, and then realize that doesn't really fit, and then they decide to transition to male. So I have a couple of videos for you. One is of Jazz. You may have seen her if you saw a 2020 video with Barbara Walters. But she's just this amazing kid who started at like 18 months. Her mom has pictures of her insisting that she is a girl. And as you watch this video, you'll realize it's pretty hard to imagine this kid as a boy. And she's clearly identifies as a girl even though she is biologically born male. Go ahead.
So then that will be your setup for the video, and then the video will be there to play the video.
Right. So some of the things that happen when kids are young, the issue is around dress. Gender is about how you dress. So we talk about social transition in kids before puberty because they are that's what works for them. When you hit puberty, a whole set of other issues come up, particularly for kids who are transgender. And this is really where things separate quite a bit, where people who may be growing up to be gay or lesbian, they tend to be okay with their bodies as they go through puberty. Now, this isn't true of every transgender person, but there are quite a few that when adolescence hits, it becomes a really horrible time because you can no longer pretend that your body is something different or that it matches your brain. So what happens is you get unwanted secondary sex characteristics. Kids during this time become more isolated. They get confused. There's a lot of social anxiety. You get a high rate of anxiety with these kids because they can't function out there and they're not being seen. And it's like torture to be constantly called by a gender that doesn't fit for you because now your body is showing everybody that this is who you are, and it doesn't match. Physical education, sex education, and dating become torture for adolescents in this stage because there's no way, it's all related to your gender, and it doesn't fit. So it's a constant reminder of how you don't fit. Many transgender youth feel betrayed by their bodies, and they will try and hide the changes under loose clothing or tight undergarments. They may go so far as to try and remove their unwanted sex organs or abusing hormones, so they'll do things to try and change their bodies. There's a process, this is true for both adults and for adolescents, and adolescents look much more like adults. So if you look at the DSM categories, they separate kids, or gender identity disorder in children, from gender identity disorder in adolescents and adults. Because once kids hit adolescence, what we find is that the rate of concordance with them staying with the belief that they are the opposite gender sticks pretty strongly. Before puberty, it's kind of fluid and they can go a lot of different directions. But once you hit, especially once you hit about 15 or 16, when somebody says that's who they are, they're probably not going to change their minds. It's about almost 100% that they stick with that. So the process for kids in coming out around having a transgender identity is first they have to become aware that they're different, that this is actually an issue. I've had a lot of kids that go on the internet because they're confused about things, and then they start finding information about these different ideas, and suddenly they come across something that fits for them. People who talk about stories that are very much like theirs. And that part of that is seeking information and reaching out. So they start looking for more stuff, reaching out to other people in the community if they can find them. And then comes the most traumatizing part for most kids is disclosing to significant others, particularly parents. They're most scared about talking to parents, particularly when we're talking about adolescents. This is true also for adults, but I'll kind of go through this with adults a little bit later. Then they explore their identity, and they figure out how to label themselves. And they can move all over the place with that, trying to figure out what terms really fit for them. If they're transgender or transsexual, then they start thinking about issues of body modification and how to get hormones. And as a therapist, you'll get brought in at this point to figure out whether they need puberty suppressing hormones, whether they need cross-sex hormones, things like that. And oftentimes, transgender folks come to you for letters to do these kinds of things. Kids, it's more of a process. For adults, they kind of come in two different ways. And then in the end, it's really integration and acceptance of who they are and expressing it to other people. Okay. So to raise a healthy gender healthy child, it really does take a village. And I'll tell you, in working with trans youth and their families, and with the Gender Clinic I'm involved with, there are a whole host of professionals that are involved. You have the parents, first and foremost. You have mental health professionals because they need medical interventions, schools because people have to interact with the schools, community educators who have to go out there and sort of help people get on board with this stuff so the kids are not as harassed as much. You need lawyers and judges to deal with all the legal stuff as well as changing documents, and then law and policymakers. And all of these pieces go into helping these kids be much more healthy. So one of the important things to know also is parents have very little influence over their children's gender identity, but they have a lot of influence over their health. And the studies show time and time again now that the more we get that kids who have supportive parents do much better on mental health, physical health, all the way across the board. They're doing much better. So I'll talk a little bit about the standards of care. I really don't have time to go into the standards of care. That's more for either you'll have to research that by looking up the standards of care on the WPATH website, or take more courses or do more reading in that, because it's pretty more in depth than we're able to go here. Yeah.
And will you be expanding on that a lot more in subsequent modules?
No, I will talk a little bit about some things that need to be addressed, just the overview, but not the standards of care themselves. So some of the main things that you need to know, sort of the basics, are you're going to need to work with an interdisciplinary team if you're working with youth. You can't just sit in your office. If you're working only in your office, you're not going to do very good work with these folks. You actually become much more of a social worker when you're working with these families. You need to connect with the community. You need to work with schools. You always need to listen to the child or the youth. The youth will tell you who they are. we often have a tendency to say that they can't possibly know who they are. But kids do, and I invite you to think about how you knew who you were. When did you know what your gender was? Most people, when they think about it, they knew it from the very earliest that they can remember. And it would be hard for somebody to convince you that you were other than that. And transgender kids are exactly the same in that way. You need to be mindful of parents and caregivers. You can be mindful that they are often blamed for their kids' non-conforming behavior. There are huge regional differences. If you're in a conservative community, it's going to be much different than if you're a very liberal community. Parents may not trust you. The kids may not trust you. You're going to have to build that with them, and that they know that you've got their best interests at heart. And they need to know that you're not going to also, that you're not going to harm their child by stopping the process that needs to happen, and you're also not going to harm them by pushing it too fast. Because some people are so supportive of trans youth that they don't think about maybe some kids don't need to transition. The parents may feel that they have done something wrong or have a wrong child, and you need to be able to sit with some of those things. And sometimes it's really hard to sit with parents who are expressing these kinds of ideas about their kid. And also know that parents may be maligned for supporting their kids. You also have to be very careful of your own feelings and reactions. You have issues around gender norms, gender roles, transitions, things like that. People who don't present well as a transition person. You really have to work with your own stuff because you're going to have trouble working with these folks if you haven't done your own work around this. A little bit about the DSM. It's a little contentious at this point. Gender identity disorder entered the DSM about the same time as ego-dystonic homosexuality was removed. It is seen right now by the transgender community as another way to pathologize homosexuality, in particular with the youth, because many gender nonconforming youth grow up to be gay or lesbian. And we're talking about the younger ones pre-puberty. The diagnostic category of GID, it's gender identity disorder in childhood, pathologizes cross-sex behavior. It has led to the belief in gender conversion therapy. There are different ways that people deal with this stuff. There are two camps of treatment for children. There's the affirmative camp, what we call gender affirmative or growth therapies, and there are the conversion therapies, which are much more behavioral. You got to know that people who engage in both of these really believe they're doing what's right for the kids. Gender affirming therapies, you follow the lead of the child, you help the parents nurture their unique child, and you advocate for the child. In conversion or behavioral therapies, you're going to be used behavioral or aversion techniques to get children to behave in a consistent way with their biological sex. In those situations, the kids are considered a success when they act in ways that are congruent with their biological sex, regardless of how psychologically healthy they are. So they can be very depressed, but as long as they're acting like a boy in a boy's body, then they're okay. So a little bit about diagnosis. Diagnosis is, it's a description of something with which a person might struggle. It's not a description of the person or the person's identity. I think that's really important. I think we're pushing more for gender dysphoria or body dysphoria as a term in the DSM because if there's a clinically significant piece that comes up, it's that. For a lot of kids, they don't have that because if they're allowed to socially transition and they're allowed to go on puberty blockers before their body goes into secondary sex characteristics, they don't end up with gender dysphoria or body dysphoria because they match. And so there's some issues around forcing kids to go into their puberty and create the dysphoria to make them qualify for treatment. So one of the things that's important to know is that transgender youth or gender nonconforming youth are not inherently disordered. It's the distress that's present that's problematic. So affirmative treatment is also individualized. It's important to know that what helps one person doesn't necessarily help another, so you have to be very, you can't have a cookie-cutter way of working with these families. This may involve change in gender expression and body modifications, and it may not. Some individuals want hormone therapy or need it to alleviate the gender dysphoria. Others just need to live their lives in a role or to wear the right clothes or to be referred to with the right pronouns. So it's really variable, and you have to find out what works best for the kid you're working with. So health professionals can assist gender dysphoric children, adolescents, and their families with affirming their child's gender identity. They need to help explore different options of that expression of that identity and make decisions about medical treatment options for alleviating gender dysphoria. So a little bit about treatments. For adolescents, it's important to know, because like I was saying, social transition for young kids is all that's really necessary. When it comes to adolescence, you get pulled on more to write letters for interventions. So a kid who is transgender or transsexual, who requires physical interventions, there are 3 different types of interventions that, or 3 categories of physical interventions. There's the fully reversible kinds, there's the partially reversible, and there's the irreversible interventions. We think about it in a stage process. You really want to start with the fully reversible stuff first, unless the kid's older. So the fully reversible interventions are considered social transition and hormone blockers. Hormone blockers usually come in right before Tanner stage 2 or right around Tanner stage 2 for just before puberty hits for adolescents. This stops the secondary sex characteristics, and it allows kids some time to really figure out where they want to go with this. Because once you stop that, they go right back into puberty of their assigned sex, of their birth sex. It also is good for parents, because parents are often struggling with this whole idea, and it gives them a little time to catch up to where the kid is as well, without the kid having to go into puberty and then have to go through a bunch of surgeries and other kinds of stuff to reverse all the stuff that happened because of going into puberty. So it really saves the kids a lot of medical interventions. It's much cheaper in the long run to do that if you can catch it that early. So the partially reversible interventions are hormone replacement therapy primarily. And that's the stuff that, basically with female to male hormone replacement therapy and androgen blockers are used. And doing that, they will start to gain secondary sex characteristics of the opposite sex. That stuff is partially reversible. You can reverse some things with surgery. Some things stop when you stop taking the hormones and you start going back in. Now, with testosterone, it's a pretty powerful drug. And a lot of the changes that occur are hard to reverse. It's very much like a boy who goes into puberty. Your voice drops. You might start losing your hair. You might gain a lot of hair. All of those things do not stop because you stop taking testosterone. So then you have to go through the same kind of interventions as male to female folks do to change that. Irreversible interventions are basically surgeries of any kind. So although you could say that chest reconstruction is reversible, you could just have implants and have breasts to replace those, but we consider any of the surgeries as irreversible. So definitely if you have genital reconstructions, that's the number one that's irreversible. You cannot go back and change that one. It's not possible. It's hard enough to do it the first time, but to actually reverse it is pretty hard. So that's how we consider those things.